Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Grading of dyspnea. Grading of dyspnea is given by Medical Research Council classification. According to Medical Research Council classification, dyspnea is of three grades. So grade 1. Grade 1 states that there is shortness of breath in grade 1 is seen only when the patient is hurrying up on a or walking uphill. When the patient is walking uphill, that is when the patient feels breathless. That is grade 1. In grade 2 the patient feels breathless when he is walking in a straight line, but when he was walking with his peer group, that is when the patient when we ask the patient to walk in a straight, in a level ground, and if he walks slower than the people of his own age and own sex, then that is grade 2. Then grade 3. In grade 3, even if the patient has breathlessness on walking on the level ground at his own pace, or even if the patient has to stop between stop if the patient walks for some distance and he stops for breath, and again he walks for some distance and again if he stops for breath, then that is grade 3. So these are the three grades of dyspnea according to Medical Research Council classification.
thank you and thank you for watching.